you explain how you train students in this lab, like just generally?
The students actually go through the anesthesia rotation, which is a 2-week rotation. The first week of the rotation involves simulation instruction, and the second week of the rotation will involve OR experience with real patients in the real clinical setting. And then the last day of the rotation will involve another scheduled session in the simulation lab where the trainees actually get to try their hand at providing an anesthetic on a simulated patient. So the first week of the program looks at conceptual and didactic components of physiology and pharmacological principles that are applicable to medicine, and particularly anesthesia. It allows the trainees to experience some hands-on activities such as airway management aspects, IV line placements, and familiarizes them with pharmacology and drug administrations for specific indications for applied medicine. Once they're able to identify all of these individual components, they then go to the operating room and see how the anesthesiologists are able to take these concepts and apply them to clinical care with real patients. And during that phase of the experience, they also participate and will be involved with monitoring patients and examining to see how patients react under surgery and in response to anesthesia. The last day of the training allows them to come back and function as the attending anesthesiologist after their 2-week experience, and gives them an opportunity to combine all those elements that they've learned in the previous 2 weeks, try to put them together and see what it's like to experience that as a caregiver giving holistic care. A major component of that is not only the actions that take place in the simulator, but also a debriefing component where we get the participants to analyze the types of activities that they've been doing. So when they come into the simulator as the final day, they will act as the anesthesiologist. They will interview and assess the patient. They will have a specific patient scenario that has a process where they develop a specific intraoperative problem. They are examined and evaluated for their interviewing, assessment, airway management skills, monitoring aspects, and how they identify and respond to the emergency problem that arises. And then as the last component to that, we review their performance. We get them to comment on how well they did, what they thought they did well, what they could do better, and help them direct their future activities for learning to complement some of those skills that we've tried to impart on them here in the simulation lab.
And how does working on a simulator compare to working on actual human beings? Is it comparable?
It's variable. Certainly the low fidelity simulators don't have a lot of realism, and they're designed mainly for part task training or simple types of skills. The medium fidelity simulators like SimMan, it provides a little bit more realistic component to it. And then of course the high fidelity simulators have a much more significant response to interventions and can mimic real life situations even more closely. What is interesting, however, is when you are in a simulated environment and you have a patient that's in front of you, although they are a mannequin with latex and pneumatics and electronics, when you're responsible for looking after the patient and things start to deteriorate, you take very quick ownership of the situation, and it feels very real to you. So you have that normal response that you would even if you were caring for the patient. The benefit of this is that it gives you the opportunity to test your skills and intervene without having any real impact or detrimental effect on real patients. So it's an ideal training ground for junior learners. It's also an ideal just because it gives them an opportunity to practice managing a variety of different scenarios that they may not see very frequently. Yet there's a critical component that they have to manage, and one of the long-term goals of the simulation lab is to look at human resource factors and interactions so that we can look at team management within the operating room environment. All right, so each of our patients, the simulation modules will have a specific patient profile where the participants will be given a history for this particular patient, and that provides background with regard to their current health and the reasons that they're actually coming to the operating room. So the participants are again expected to review that information and highlight any specific areas within the history that will give them direction with regard to their physical examination and how they want to plan the anesthetic. So one patient may come in, the first patient that we have is actually called Raymond Spiritore. His short name, of course, is Ray Spiritore, and he ends up with an asthmatic problem after intubation, so he ends up with a problem of bronchospasm that has to be identified and treated. So within that diagnosis of bronchospasm, there's a variety of different clinical diagnoses that could be made that would explain some respiratory wheeze during anesthesia, and the participants have to sort that out and identify which is the most likely thing happening and how they're going to treat that. Another lady, or another patient that we have is actually called Ruth Angina. So Ruth Ann actually comes. She's a little old lady, doesn't have much of a hairstylist, but we do try to make things a little bit more realistic for the participants. So she comes in, and she ends up with a problem of severe hypotension after induction of anesthesia. And she's in a situation where she will not be able to tolerate prolonged periods of hypotension. So again, the participants have to deal with that issue fairly quickly. Following that, within the debriefing, we talk about the etiology of hypotension, why it's bad for this patient, what may be the predisposing factors for this individual, and what they would have to be aware of for future management of patients that fall into this type of category. So we have a total of probably 5 to 6 different types of patients, all with unique names, all with unique cases or problems, but each case and problem is designed to highlight or emphasize a specific teaching point in the undergraduate curriculum. The hope would be that as we develop these scenarios for the residency training program and for faculty participation, that again we would identify specific sets of problems that would be amenable to demonstration and teaching in short simulator scenarios. All right. So from here I can see that he's breathing. On the monitor we would have actually all the printouts and indicators of his saturation and pulse oximetry. And I can identify what his current cardiac rhythm is in this place. So I can control his respiratory rate. I can control some of his physiological features with regard to his mouth opening. And I can make him move his neck. So he can flex his neck up and down. I can change his breathing pattern. I can change his heart sounds. And then with that, I can put him into all kinds of different cardiac dysrhythmias. So in addition to that, I can either have him cough and indicate that he is feeling very bad.
And I guess this would be for pre-op assessments.
Yes. So that would be a patient that's having some respiratory distress that the student would have to identify their problem and respond to that appropriately.
Do the students ask the sim the question?
Yes, they do.
And then you respond?
And I have the ability to do that directly through this microphone.
Oh.
So rather than having pre-programmed responses from the computer, I actually do the discussion and dialogue directly with them. So they can ask me any questions about my history and tell me how I feel and ask me about medications and allergies and
oh, wow.
when
That's
I ate
incredible.
last. And some of the standard questions is that we can tell them to go away if we don't want them there. We can also indicate that they feel very dizzy. We can tell them to say, I'm quite nauseous, very sick. Or we can actually have them, one of my favorites is the actual vomit. That's actually one of the scenarios. Because thinking back to residency. Because one of the things that happens is as they go through the induction of anesthesia, you have to secure their airway and protect it from passive regurgitation. So one of the common side effects of anesthesia could be nausea and vomiting, and again, depending on the specific operative procedure that they're having done or the medications that they're on, they may be predisposed to those types of problems that they have to identify. And then at the end of it, they say, "Thank you."
It's very polite.
Yes, very polite.
What are the long-term goals of the simulator lab project as a whole, I guess?
I think certainly the initial project that we've had with the clerkship has been extremely successful. It's viewed as a very valuable component of our undergraduate educational curriculum and has been very helpful in trying to relieve some of the learner demands in the operating room and the faculty within the hospitals in the city. The next expectation would be to roll this out for a more significant component of the residency training program. At this stage, the residents are heavily involved in training on the simulator as instructors because they provide a lot of the instructor personnel for the clerkship training program. But what we would like to see with regard to the residency training program is that the residents come in and they're actually the individuals that are put on the hot seat to manage specific patient situations. So we're going to use this to complement didactic training, OR experience, and also help prepare them for Royal College examination processes, but more importantly, prepare them for their clinical practice and the things that they might experience out there. So it again forms the continuation of the lifelong learning aspect. Down the road, we hope to have enough resources and faculty to be able to schedule our own faculty and anesthetists that want to come in and try their hand at simulation experience. Again, it provides a great environment for testing yourself, for self-reflective learning, for situations that you may not encounter very frequently but still have to have an expert level of performance or knowledge base in order to deal with those events as they occur unexpectedly. And that's one of the aspects of anesthesia, which has always been an interesting element, is that the problems that arise are sometimes unpredictable, but you're expected to be able to deal with them and have a positive outcome as a result of that.